see a sneak peek of Cusp's Anatomy. This episode entails the story of an 8-year-old girl named Ophelia who was admitted to the hospital with a high fever of 103.8, an elevated heart rate, elevated respiratory rate, and had cloudy urine with bacteria, urgency, dysuria, and CVA tenderness. She also hasn't been drinking for the past 24 hours as well as eating, and she's suspected to have acute pyelonephritis. First things first, what is pyelonephritis?
An acute bacterial infection of the renal pelvis, tubules, and interstitial tissue of one or both kidneys. In almost all children outside the immediate newborn period, pyelonephritis develops after fecal flora colonizes the urethra. Bacteria ascends up the bladder to the ureters and then to the kidneys, leading to infection and inflammation. Risk factors of pyelonephritis include patients who hold their urine and do not empty the bladder completely, have poor toilet and hygiene habits, recurrent UTIs, abnormal structure or function of urinary flow, diabetes, immunocompromised patients, viscerochoroidal reflux, which is an incompetent valve resulting in the backflow of urine from the bladder, and being female, because they have a shorter urethra than males and it's closer to the rectum. Signs and symptoms include chills, fever, bacteriuria, pyuria, dysuria, low back pain, flank pain, CVA tenderness, nausea and vomiting, headache, malaise, frequent and painful urination, and loss of appetite. Diagnostic tests include a urinalysis, urine culture, ultrasound, CT scan, voiding cystourethrogram. A urinalysis is a testing of a urine sample. An infection is indicated with a positive leukocyte esterase, nitrates, increased pH, and the presence of red blood cells, white blood cells, or bacteria. A urine culture is performed by placing part of a urine sample in a tube or dish with a substance that encourages any bacteria to present growth. Once the bacteria have multiplied, which usually takes 1 to 3 days, they can be identified, and the healthcare provider can then determine the best treatment. An ultrasound uses a device called a transducer that bounces safe, painless sound waves off organs to create an image of their structure. The images can show obstructions in the urinary tract. Ultrasound is often used for people who do not respond to treatment within 72 hours. CT scans use a combination of X-rays and computer technology to create 3D images. A CT scan may include the injection of a special dye called contrast medium. CT scans can show any obstructions in the urinary tract and is often used for people who do not respond to treatment within 72 hours. In Figure 1, it shows normal kidneys, and in Figure 2, it shows diseased kidneys.
We are first going to assess Ophelia, like checking her vital signs and observing her signs and symptoms. Then we're going to check her lab and culture results, and from there we're going to see what we're going to do. So follow me in this nursing care with this little girl. Come in. Hi, Mrs. Johnson and Ophelia. I'm Eunice. I'm going to be your nurse today. How are you feeling?
I don't feel good at all.
Yeah, she's been complaining about a lot of lower back pains and issues with peeing.
I'm sorry you're not feeling good today. Well, I'm just going to start off by getting your blood pressure, listening to your heart and lungs, and just seeing how everything looks, okay?
Mm-hmm.
All right. I'm just going to put this around your arm. Okay, so your blood pressure looks normal. It's 118/78, but your pulse rate's a little bit high. I'm just going to listen to your heart, okay?
Mm-hmm.
All right, now take a deep breath for me. Okay, now let me just sit up and listen to your back. Keep taking deep breaths. Okay, go ahead and sit back down. I'm going to listen to your tummy now.
Ouch.
Does that hurt?
Mm-hmm.
Does it hurt on this side too?
Yes, it hurts on that side.
1 to 10, 10 being the worst pain. What is it?
9.
9? Okay. Well, let me check your back. If you can just sit up on the side of the bed for me. And scoot a little bit over here. Okay, Ophelia, tell me if you feel any discomfort here, okay?
Okay. Ow.
That hurts?
Mm-hmm.
Okay, let me just check this side.
It hurts on that side too.
Okay, well, thank you. Let's just go ahead and lay back down. Hey, Mrs. Johnson, so what I just checked was CVA tenderness, which is costovertebral angle, and that just kind of indicates if there's any pain in the kidneys, seeing if there's any issues, which she seems to show some discomfort. She was admitted with a high fever of 103.8 with an elevated heart rate, respiratory rate, and they did a urine sample back at the pediatrics office that showed that her urine was cloudy, it had some bacteria, and she's having frequency and urgency peeing as well as dysuria. So we're just going to wait for those labs to come back along with the culture results. And the doctor recommends that we start her on antibiotics immediately through IV as well as fluids since she hasn't been eating or drinking in the past 24 hours.
Okay.
Do you have any questions?
Actually, yes. What antibiotics will she be put on?
The doctor is going to start her on ampicillin. We're also going to give her normal saline for the fluids. So,
Thank you.
all right. So we have our normal saline and our antibiotics, which is ampicillin.
Come in.
Hi, I'm back.
Oh, she's sleeping.
Oh, that's fine. I just wanted to let you know that the labs and culture results came back, and it does show that she has kidney infection. So the best thing we can do right now is to just decrease her fever and treat the symptoms. So we're going to continue the antibiotics and IV fluids.
Okay, how long will that be before?
The antibiotics are going to continue for at least 48 to 72 hours or until Ophelia starts feeling better and she has no fever for at least 24 hours. And when she starts feeling better and she can eat and drink again, she can go back to oral antibiotics.
Okay, thank you.
Is there anything else I can get you right now?
No, not right now.
Okay, the call bell is right here and just let me know if you need anything.
Okay.